Lower back pain that just won't go away. Millions of people worldwide suffer from this problem. Now, medical experts in Japan are developing new ways to bring relief. Japan is a world leader in cutting-edge medical technology and healthcare services. Join us as we explore medical frontiers. The reasons for lower back pain remain a mystery in the majority of cases. But recent studies show physiological stress can influence the way the brain perceives pain. Now, orthopedic surgeons and psychiatrists in Japan are teaming up to offer new options for treatment. A herniation of the spinal disc can require surgery in serious cases. Japanese doctors offer a surgical procedure that's less taxing for the patients than conventional operations. There are also hints to be found in a traditional Japanese sport. We'll share an exercise rooted in sumo movements that can help you avoid backaches.
Welcome to Medical Frontiers. An estimated 28 million people in Japan suffer from lower back pain. In fact, about 40% of people in their 40s to their 60s are understood to be living with lower back pain. Chronic back pain can make it challenging for people to work, and it can even force some people to have to quit their job. Loss of regular income can also have a significant impact on patients, especially when they're already burdened with high medical bills. Many people around the world are seeking far more effective solutions than the ones that they currently have available. In one hospital in Japan, surgeons and psychiatrists have teamed up to provide patients with both physical and mental care, and they're producing impressive results.
Cartilage from between the vertebrae has gotten pushed out. This puts pressure on the nerves and causes pain. Akira Dezawa is a surgeon specializing in lower back pain. He has developed a new approach that is less taxing than conventional operations. He uses this endoscope. Dezawa had it customized to his specifications. The tip is less than 8 millimeters in diameter. Standard endoscopes have a diameter of about 16 millimeters. They're too big to fit into the space between the vertebrae, so some bone must first be scraped away. This is hard on patients and sometimes requires they remain in the hospital for more than a week. The new endoscope is small enough to pass through the space without scraping any bone. This procedure is much gentler and doesn't require a hospital stay.
Many people who work can't afford to take a week or two off for surgery. They might lose their jobs. So if they can just come in for a day and be done with the procedure, they can resume their jobs and their lives right away. That's quite beneficial.
Microforceps, a tool like a pair of scissors inserted through the scope, is used to remove the herniated part of the disc. Dezawa refined this part as well. He uses parts with different custom-made tips. For instance, this one can bend. This delicate movement is handcrafted in Japan. This image shows a cross-section of a herniated disc. The cartilage is protruding outward, pressing on the nerve. Dezawa's bendable tool can curve around and make it easier to cut out the affected area. we had a chance to record Dezawa performing surgery. The patient is Megumi Kawashima. She's suffered from lower back pain for more than 20 years. Conventional surgery requires general anesthesia, but Dezawa can use local anesthesia for his technique. He inserts his endoscope between the vertebrae. The portion that looks like blue cotton is the herniated part. The color comes from a chemical used for surgery. Dezawa removes the damaged tissue. The procedure requires dexterity and experience.
はい、終わりました。じゃあ、ご苦労様でした。
ありがとうございます。
ちょっと痛かったね。
The surgery is over in about an hour. This shows the herniated area in blue before the operation. And this is how it looks after removal. 3 hours later, Kawashima is already up on her feet, ready to go home. We visited later to ask her about her recovery. She says the pain she'd felt for so many years had disappeared about a month after the operation. She can now work and do things around the house without any problem.
The cut from the surgery is small, only about a centimeter or so. It's barely noticeable. And to think that I had the operation as an outpatient is incredible. I was already walking a few hours after the procedure. It did hurt a little, but I was walking. That was amazing.
As we saw in the report, there are a number of different approaches for treating chronic lower back pain, and each of these approaches has its own specific and unique benefits. But it's not possible to solve the problem with one single method, and we believe that if hospitals and doctors would work together using a comprehensive range of treatments and also integrated treatments, then a lot more people would be free from chronic back pain.